just chop it. As a surgeon, obviously. I've seen the results myself, but you're left with that Xanthelasma.com. This is only talking about laser and blow them away in no time. And this is guys here. You still worry a bit. Somebody came to me with a couple of questions, said I'll answer in front of everyone. It was about the very stupid questions people were a bit shy about. Yes.
About exercise.
Oh, exercise. Yes, that's really good. That's not. And then someone else asked about the color of the Xanthelasma. Okay. Okay, let's go with the exercise. This is a very good question. It's why it's very important that we answer them right now. What you do, so people can exercise as soon as the scabs are fully formed, because what we're trying to do is avoid risks of infections. I have exercised even the day of the treatment, so nothing may happen. However, as good practice to make sure that the area is completely free from any possible likelihood of getting an infection, so wait until the scabs are formed. Does that make sense? Yes. So, but in practice, I have tried it, well, because I exercise every day. I'm a junkie, so I've done even soon after treatments, any type of treatment. So if I've done, I'm still alive and I haven't got any scars. So then we had the other one, yes? Yes, yes. Yes, you do use the spray method. We've got a video where we remove Xanthelasma. So multiplasma.com, go into Xanthelasma removal, there's the video in there. Unfortunately, we didn't get the after pictures, because it's not always that we get them. Sorry? Yeah, it's possible, because it's not for some reason viewed as often. Just go on voltaic plasma, go on Xanthelasma removal is in there. It's not gone. I'll give you the answer we pop again is on our website, but I'll try to give you the answer here. I'll make a nice sketch. So Xanthelasma are quite, so if you cannot see, please let me know. And pardon the way I draw. It's really, really bad. And there's a video where I actually explain this thing in detail. But the problem with Xanthelasma is a type of lesion where if it's red, I mean, it's normally yellow. I don't have the yellow pencil, the yellow marker here. If this is the Xanthelasma, this is the skin, this is the epidermis, this is the dermis. The Xanthelasma, in reality, although you see a bit of it, some of it, or most of it, depends on the Xanthelasma is inside the skin. So what happens is, you haven't removed it completely because you have just taken off the superficial bit. But you haven't taken it off completely because very likely it's inside the skin quite deep. So if you want to remove it within one session, you have to make sure that you go deep enough. And then you can recognize, sorry? Yes, what you do, you burn it, you wipe it off, get a good light in it, make sure that you can, if you can still see the yellow bit, you keep carrying on burning. Yes, because you can actually go up until here. If you go up until here, you still see the yellow bit, if it's quite deep. Because what you've done very likely, as you would want to do, is just level it off. But mostly, Xanthelasma, you level them off, they reappear again. It's not as if you haven't done the job. You have done the job. But what happens is, well, if you remove it, say, for example, up until here, then when it heals, that part goes back. So you still see it. It's smaller, but you see it. So the client gets back to you, say, oh, hang on a second, you just should have removed it. It's still here. So, but if you know this trick, then you can remove it in one session. This session, if you remove it in one session, you've got slightly higher likelihood of scarring. In reality, even if you get a slight scar, it's not a big deal, because if you have the yellow marks and you have a slight scar, you're happy with the scar. But if you do it properly, then you shouldn't get any scar. And then if you're not sure, if you cannot see it properly, if you cannot see that yellow bit properly and you just level it off, let it heal and treat it again. Because every time you treat it again, that part is less and less, so you may be able to remove it within 2 to 3 sessions. Yes, exactly. This is what I tried to say before. You just watch, as you burn it, get a good light into it with a magnifying glass or something of the sort, and then see whether you still see the yellow of the fat deposit. If you still see the yellow bit of the fat deposits, you still go. Sometimes when you remove them surgically, it's like you get a void. You get a big hole in there. So this is why when they're removed surgically, what you find is that the surgeons normally sew it up because there's a lot of skin that's missing there. But if you remove it properly, it shouldn't be. You can remove it within one session. If you're not sure, just have the client to get back again, because what happens is the xanthelasma will still be there, but it will be smaller. Yes.
Sorry, Andreas. What does a cholesterol spot look like?
Is that
like a white mark?
No, it's yellow. It's yellow on the yellow. Called xanthelasma.
Can I show the picture of xanthelasma?
Can you actually send it? Can you send over through WhatsApp? So the point is.
To show other people. Yeah, I will send it.
Yes, please send it to us. What are you wanting to say about that? Is that xanthelasma?
Yeah,
Is it? Yeah, okay. Please send it over. We have a website that we've developed. It's called xanthelasmaremoval.com. You'll find ins and outs. You can remove xanthelasma by other means, but go on xanthelasmaremoval.com. Yes. Milia? Milia as well. You should be able to pop the milia using arcing. Yes. Yes, you should be able. I have never done it myself, to be fair. I've never done it.
But you should be able to do it.
Yeah, I should be able to do it. I don't see any
If
reason.
it doesn't work, it won't do any damage.
No, I wouldn't say so. Any other question? Yes.
If 1 month after, 2 months after, the person still have it's not hyperpigmentation, it's like very, very sensitive skin on the eye.
It's,
What to do?
well, what device did you use? Oh. What did they say anything to you? How much did they charge you? Tell me the truth. Come on, I know the prices. For the Accord device, did they do training for you? I don't know.
100,000 plus backed on at 150.
Oh, okay.
And
What did it? Yeah.
sorry, I was thinking of something else. Sorry. No, I didn't watch it. What help have they given her? What have they
Yes.
said?
What help were you given?
But what, my question is, if it's still sensitive, it's not hyperpigmentation, but what I see on that person, she still have like white, red, and like a sensitive.
Yes. I'll answer the question. It's very easy.
Red, not like pink.
I want to be cheeky. I can't really help myself. I want to be cheeky here. Did you ask the same question to them?
No.
Oh, why? Okay, fair enough. I'll answer your question. It's very simple. Yes. Well, by the way, please come. You find our details online. You've got my WhatsApp. Our WhatsApp number is on areton-ltd.com. Talk to us. Ask us questions. Okay. So using WhatsApp, using the messages, send us pictures.
What would you say to them?
So that is very simple. Very likely there's two things. I wouldn't get worried about it. This is very normal, especially when you do harsh treatments. Even if you didn't do a harsh treatment, maybe the person is quite sensitive, but it will go away. The area can be red and sensitive for up until 3 months or sometimes even longer. So I wouldn't get worried about it. Only, you start getting a bit concerned if they get hyperpigmented, because then you have to take action in order to get rid of the hyperpigmented area. But if it's red, up until 3, even 2 months, perfectly normal. Because this is why we say, don't wait 1 month and then redo the treatment. This is a classic. It's quite normal. I wouldn't get worried at all. This is the real, the answer is very, very simple. We've seen many of them. Any other questions? No. Well, you can still try and do the treatment, but basically what you're trying to do is, what you can do with these treatments is tighten the skin. That's what you can do. But getting that sort of dark area may not go away.
Acne skin.
Acne treatment, active acne. With our device, you shouldn't use it because it's a medical. With the plexer, you can. I mean, again, we're talking about legislation in Europe, okay? Legislation. If no law, it's the Far West, do it. Yeah. So what you do, the method that's used is, this is what is being taught in Italy, was taught in Italy. You just put little dots around the acne, and then one spot in the acne, active acne itself. Yes, and you let it heal. That's the technique. I've never tried it, but this is the technique that's been taught there. I'd say try with the lowest, lowest, especially around the acne.
Sorry, what is the difference between the Acne and your machine?
The Accor, I think, has got 2 power levels, or sometimes 4. We've got, ours is made in the UK. They say it's made in Germany. They said it was made in the UK first, and they said made in the UK, in Germany. They changed the place of manufacture quite easily. They have, I think, 4 2-power settings, and ours has got 32 power settings. The level of support you get, and also the lowest power setting is far lower than their power setting. Our highest actually surpasses it by miles. Again, yeah, ours is a bit bigger. We Italians have got it bigger. Did I answer your question? Yes. And also about the support you get. We get people from not only this very nice lady. Are you from Russia? Yes.
Can I ask? Can we hold back a bit on questions? A lot of girls are saying, "Please, can you move on? Can you move on?"
Yeah.
I think at the end of the day, all your questions are going to be answered.
But I love these questions because it's all relevant.
But we need them, but we might not.
Yes.
We might lose out on other important information.
Yeah. Okay.
So let's hold back a little bit on questions so you can get through, and then we
Yes.
keep note we want those questions.
Okay. Write the questions down. Okay, tattoo removal. I haven't seen this presentation before. It's been made for me, so I'll improvise as I go along. So now, tattoo removal. This presentation is about how you can remove tattoos. And we're talking about tattoo removal because there's many things that people do not know about tattoo removal, and we're going to cover them here. The terminology is normally used as tattoo removal. In reality, tattoos are extremely difficult to be removed. Extremely difficult. Look, let's forget about the before and afters. In reality, especially with larger tattoos, the real seamless removal is very, 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 very difficult. I remember in the UK, some people get quoted for a large tattoo removal like this in the region of 20 to 30,000 pounds. The reason is, it's very difficult. It's not an easy job. What we say is, tattoos can be faded, but not guaranteed. You cannot guarantee a total seamless removal. I've seen so many tattoo removal treatments results. In reality, seamless removal is extremely difficult. I don't know exactly where this picture was taken from. I'm not sure, but many are quite of doubtful origins. So, especially given the experience, if you have different experience, please share it. But so far, with laser tattoo removal, I haven't seen one case of seamless tattoo removal. Okay, so normally there's some sort of marks, scars, long-term. You'll see there's a ghosting factor in tattoos after they've been removed. What happens is people realize that they're quite difficult to be removed, so they stop the treatments, and the treatments can be expensive as well. You get burns with lasers and so on, and you get texture change and so on. All these presentations are going to be online. You can download them anyway. So tattoos are made, why are they so difficult to remove? Because they're made to last so far. So they're made to last. So the pigments go inside the skin. They will fade slightly over time. So in the tattoo treatments that we've got available up until today, especially with the lasers and so on, what we're trying to do is accelerate that process of tattoo fading by injecting light into them. Because what happens if you expose a tattoo to normal daylight long enough and you don't, if it's exposed long enough, then it's going to fade quite relatively quicker than a tattoo that's not been faded. That's a tattoo as it was freshly healed and 13 years later is you get a certain degree of fading over time, and this is mainly because of light. The exposure of the tattoo to light, which breaks the pigments, and little by little, that tattoo fades. And what we're doing with lasers, because there's the conventional way that we all know, the expensive way to remove tattoos or fading them, they're faded that way, and that happens more quickly. And this is a picture. See whether it actually shows it there. It's a tattoo. The tattoo actually is not on the epidermis, it's actually inside the dermis, and this is how the tattoos are made. So they're quite difficult to remove because the pigments are meant to stay there. And then if you want to remove a tattoo, what you have to do is actually getting into the dermis. This is why tattoos are very difficult to remove completely. We've got some good examples anyway here about using plasma. We'll see that later on. One of the ways to remove them is by using either, well, I think this is cryotherapy by the look of it, maybe? Maybe? I don't really know. Again, I haven't actually done this presentation myself. One of the ways cryotherapy, but it's not very, a very good way, because cryotherapy doesn't get into the dermis. But light is good because it penetrates into the skin. So the most common way is later tattoo fading. And there's various lasers for that. And there's various lasers at different wavelengths that are good for certain colors and so on. I think something is there for that. And also there's tattoo fading using plasma, which is actually surpassing by far the laser tattoo removal, but it's got some drawbacks. And it can remove, actually sometimes completely remove tattoos in 1 or 2 sessions. But removing tattoos, you cannot actually tell how many sessions. You cannot predict how long it's going to take to fade effectively or remove a tattoo, because it really depends on the equipment that's been used in order to make the tattoo and the pigments have been used for that particular tattoo. And you can tell after a patch test, usually. This is, in my opinion, the best way to remove a tattoo. This is the true tattoo, is surgery. In some cases, you can do it. You can do it. You think it's bad. If you think this is bad, I do understand, because you've been exposed to the marketing of tattoo removal, where they show you seamless tattoos being completely removed, supposedly being completely removed seamlessly. But this is extremely rare in reality. They always have a sort of ghosting effect. Did anyone have a tattoo removed completely within 1 session, 2 sessions, or a laser without any trace? Does anyone have any tattoo? Okay. Do you consider removing them? Good. Listen, if you have any friends that have experienced something magic and they have it completely removed, please let me know. I'll be very interested to have that knowledge. But so far...
Can I, sorry, we do want to be tattoo-free as well. Just remember, when you see other people advertising chemical removals, I know there's more coming on the block now, they will show you the before and the seamless after. I mean, come on, girls, you know, there's a lot of photoshopping happening for marketing purposes. I said, don't show me that, show me the progression. And you'll see the progression is exactly the same. You know, it's got the wound, it's got the scab, it's disgusting. It's all there, but they don't ever put that out there. With Premier, we put it out there. This is what you're going to go through. Are you prepared to go through this? And yes, we don't walk on water. We will take your income. Are you going to scar? Maybe. Are you going to hyper or hypopigment? Maybe. Are you going to keloid? Maybe. You know what I mean? You come to us to remove the ink. And I'm sorry if I can interrupt you.
No, please.
What people do come, people arrive at you and the client has the misconception when she went in to have the tattoo put in. It was, she got it, oh, it's gorgeous! And she thinks she's going to walk into you and you're going to go, oh, it's gone! And I'm back to this! And I said, if I had walk on water dolls, then one person had to do that for you. And he doesn't live anymore. Right here. Do you understand what I'm saying? We will remove the ink. What's going to happen? Are you prepared? Something legacy form. But we'll work with you. We'll help remove the wound. We'll help remove the scar. We have ways to remove the wound and the scar. So you can't think you just go, oh, it's good, you're so happy, what's it? And if it happens and stuff, we all say, wow. Because the odd one does happen.
Bobby's gone. Peter's here.
So again, if you think this is scary, I think it's one of the best ways because, yes, you have a scar, but you don't need to get burnt with a laser a number of times. If you, I think we'll show you a picture on a number of pictures later on what the skin looks like after the burn of lasers for tattoo removal. You develop blisters. Fully fledged blisters. And nobody shows you these blisters. And I was very interested when I first realized, hang on, every time you get a tattoo removal treatment using laser, you have blisters of this type and nobody shows you. And that's the truth. So personally, I think that sometimes it's even better to do it that way. It was actually a doctor in South Africa said, why are you doing it this way? You just chop it. As a surgeon, obviously, a plastic surgeon, you just chop it. You just do this. You just chop it, just sew it back in. Really?
And then the scar?
Yes, and then you leave a scar as well. But then my point is, in my view, is sometimes much better, especially for small tattoos, because this area, for example, of the arm, sometimes has excess skin, so you can get away with just chopping it and sewing it back, and then the scar, sooner or later, is going to get better and better. And then you can treat the scar. So it's another way, but this is for surgeons. I personally like it. I'm not a surgeon, but I like it that way. Because I know what is bad. But this is a real case. A tattoo removed using salation is, sometimes you get very good results. And then we're going to show you some other results of tattoo being removed using plasma and osmosis. Again, please pardon me, I don't know where these pictures came from. I do not know it's been made for me. So,
Yes, a team working back in his office.
so yeah, so I should have actually looked at this. I haven't. So you can actually use dermabrasion. There's many techniques in order to fade tattoos. Also peels. TCA is another way. Basically, what you do is just you burn the skin again using a chemical, TCA. Is anyone not familiar with TCA? Not familiar. One person is not familiar? So who's not familiar? Who doesn't know TCA? One, two. Everyone knows about TCA pretty much. It's a chemical peel for peeling procedures, and you can use them for tattoo removal as well, with a certain degree of success. Some people try to play it down. I wouldn't say so, but it's a way of doing it. There's cryotherapy, which is not the preferred way. And also, some people use IPL, intense pulse light, in order to fade the tattoos. It's not a bad way either. And this is the reality, the sad reality of tattoo removal, especially for large tattoos. When you go through, you cannot actually remove this surgically. You've got to remove the whole skin. You can't do that. You've got to do skin grafting after, no way. So you cannot even use surgery. So you've got to do something about it if you really want to remove it. If you want to try and you don't like the whatever you've got there. So one way that is quite successful is by trying to fade whatever you don't like, using a laser or other techniques, even plasma if possible. And once it's faded enough, you do a cover-up. And this is exactly what happens, especially for large tattoos. These are called the double layer tattoos. They're not uncommon. They're very, very common because people, after a number of years, realize, oh, what was I thinking? Now, 20 years later, I just don't think that lovely name is, nah. So this is what happens. But everything has got pros and cons. The pros of electrical arcing, we're going to talk about it, I think, so look, where are we? This is, okay, frosting, discomfort and pain, just so I get familiarized with myself. Okay, this is the blistering with the lasers, and there's so many. It's only a minor blistering. It's amazing what sort of blistering you get. And they all happen in that way. So I'll try to remember off the top of my head pros and cons. Okay, we're going to compare only briefly plasma treatments and laser treatments. The pros of laser treatments is that once you decide on a setting for your device, you go really quickly and you charge a lot of money for it. And there's relatively little that can go wrong for two reasons. Is because, yes, you do get the blistering, but the blistering there, where is it? You get this blistering there. First you get the frosting immediately after in the redness, and then you get the blistering the day after, 2 days after, and it goes away. It's quite painful, but you do it really quickly, and you can treat large areas. And you're not worried about the area being infected as much, as long as the blisters are not tampered with. They don't actually break the blisters themselves. This is one of the main advantages versus plasma. The main disadvantages are several. One of them is that lasers are very expensive. If you compare price, very, very expensive. Although some laser manufacturers tell you that they can remove tattoos within 1 to 2 sessions, they can even guarantee it. It is true, they can. I've seen the results myself, but you're left with a skin texture change, which is permanent. So it does happen, and I've seen it. I've seen the results. It's true, but you do get a scar of some sort. So it's not seamless. It does happen. Or you have to undergo a number of sessions, 10, to have an acceptable fading of that tattoo. But again, everything has got advantages and disadvantages. And lasers are not, unfortunately, as a disadvantage, are color sensitive. So certain wavelengths work well on certain colors, and certain colors cannot be really treated or faded really well using lasers anyway. Now, the advantage of plasma is that normally it takes 10 sessions. You can take 2 sessions, 1 session at a time. So we've got the proof in here. The same degree of fading that you would need to get, say, maybe 5, you get in 1 session with osmosis. The main disadvantage is that mainly you have to be more careful when you do the treatment with plasma, because you can actually go inside the dermis and cause a scar just by the treatment itself. Then if you want to go a step further, then you apply osmosis, and even that is quite a harsh treatment. So you have to be very careful. And the area can get infected. It can happen, and that can cause scars as well. But if you get it right, you do get the results that lasers cannot. You cannot match them. Lasers, you blow them away in no time. And this is a few proofs there with this device here. Okay, it's not. We don't make that device. It's true. It does work. The other disadvantage is that because you cause an open wound, you should only treat smaller areas than you can with lasers, because in lasers you don't cause an open wound, please. Yeah, I'd say so. Like a small rose, something of the sort. Or even a bit larger, but you shouldn't go too large. The larger you go, basically you're exposing that area. It's extremely susceptible to, yes, infections, yes. And normally what...
Massive tattoos. I haven't seen the number of clients with this kind of tattoo, you can probably put on your one hand.
Yes.
Come with things. Yeah, I don't even touch these, but they come with things that are probably 10 centimeters.
Yes, if it's small, they're quite easy, and it shouldn't be a problem.
The only reason, sorry if I can interrupt, the only reason that I do a lot of tattoo removal, the only reason is, as Andreas says, the more skin you expose, the more chances of infection, because you can't do the aftercare at home.
No.
Picking up pets, kissing pets. One time got an infection in a ring, and she said, "Only problem is my little dog won't stop licking it." I said, "You're kidding! You are kidding!" She said, "You don't know what they're doing at home." So I would do a whole back. But can he look after the whole back at home? I've opened up all that skin that can get infection. So we get in little pieces and he's got full control over it. That's the reason.
This is a good example here, because a colorful tattoo. This yellow here, you wouldn't even you wouldn't think you'd get good attenuation using a laser. The other problem is that even if the area is not infected, you get a big scab. You don't want to get big scabs, because if the scab is big, then you get stretching and all that. Even if you don't get infection, it's not as easy.
And then, sorry, that's where Mandy, our skin specialist, and she wants to do a workshop with every single one of you. She wants to teach you how to identify what's infected, what's not infected. I think we're going to have to do that morning workshop with Mandy. Because she said she can't keep having us asking her all the time, because she runs a very big clinic and she can't keep talking to us. But Mandy is telling us 3-4 days we start softening that scab. It's done its job, now we start wound repair. Whereas Ron said keep it 3-4 weeks if the scab drop off, and here and Ron have long chats. And so like that scab, do you want to sit with that big scab that's crusting and putting away? And Mandy says no, we can get it off. So you see, our protocol is changing, and people say, "Oh, what do we use? What do we do?" We're going to get there. We're going to get there. We're going to be. So we've got.
Mandy's also a freaking expert at dry needling and all of that.
Wound repair.
She believes in treating acne skin big time with dry needling and Dr. Pins and so on. So she's going to give us a workshop on that as well.
So, but what I'm saying is, Andreas hasn't met Mandy yet, but Mandy, just what did Andreas say here about the scab, the horrible scab? What did you just say?
I say that even if there's no infections, then you have to deal with a big scab, and then if you have a big scab and you're doing normal movements, then that scab is bothersome and it could cause a bit of problems.
We problem with somebody on the leg here. We're busy with the moment, and Mandy said this is a very difficult part. And remember, it's not fun. There's a lot of movement taking place. It's tugging, it's pulling, it's tugging, it's pulling.
Yes.
The scab is being tight by the healthy skin, So there's reasons why that's happening there. It wouldn't have happened if it was there, but it's happening because the tattoo has been removed there. So we've got to learn all of that. No? Yeah.
And yes, so that's that's pretty much these are the sort of, it's not uncommon to get this sort of results after tattoo removal treatments, even using lasers. You can get these. And then you can get hyperpigmentation. You can get all sorts of problems. One of the problems you get with tattoo removal using lasers is quite, especially skin types 4, 5, 6 is just you get hypopigmentation. Even the 1 or 2, you do get hypopigmentation. Unfortunately, lasers do kill the ability of your skin to produce melanin as they normally do. That's a matter of fact. And it doesn't matter whether you're using a laser that is expensive or not. The lasers, all they use is light at certain wavelengths. So if you expose skin to intense light, you're exposing your skin to light that's been exposed to a burn by intense light. It's like being outside, like being outside in the sun for long enough. Being in the sun is different because it's also got UV light, which lasers should not have, and they do not have, even IPLs don't have, but it's still not a good thing to get skin exposed to lasers, high intense laser light too many times for too long. Yes, this is hypopigmentation is normal with lasers. I'm sorry to say it, but it happens quite often, and you see it especially with darker skin types. And so in order again to close this, it's just I talked briefly about advantages and disadvantages. For tattoo removal, some tattoos you're better off using a laser because they're too large and so on, and you can just advise always your clients that tattoos can be faded, but never, very seldom removed completely, especially the larger ones, even with the best expensive lasers that you can buy. It's not as if you throw money into a laser, you get something better than a cheaper one. It's because lasers use light. Light is just light to a certain extent. You've got pico lasers and so on, but it's simply light. So if you've got large tattoos, tell your clients to manage your clients' expectations. Even if you're turning, it's our advice, even if you're turning business away, make sure that you don't treat people who think you can, in reality, remove the large tattoo completely, because in many cases is unrealistic. If you have smaller tattoos, then yes, use plasma treatments. Very likely 1 or 2 treatments will do the trick, and then this is a more appropriate treatment for a small tattoo, because you're not a surgeon, you wouldn't actually cut it and sew it back. So a plasma treatment would be better, and you'll see a few of the results. It's absolutely amazing results. And then if you want to treat large tattoos using plasma, it's going to be extremely difficult. It takes loads of sessions. Every session involves scabbing and so on, and the client knows what it feels. Don't even think that if they go for the laser route, they're going to be all happy and dandy. Very likely, normally, on average, they would go for 3-4 laser treatments. They realize it's painful. They realize every time that there is a tiny bit of fading, but still they have a long way to go. Then when they're happy enough, they're going to get a tattoo cover up. So that's, any questions about this?
Does the thing go out the body? Because the laser basically breaks it up fine enough so that it goes into your bloodstream and goes out the body via your lymph system. But with your technique, does it actually go in the scab and it's out the body?
It's not my technique. It's been used for a number of years, but the abrasion, yes, you extract it. You sort of extract it to a certain extent. This is why you use osmosis, you use salt, because the salt, yes, the salt has the ability of drawing those pigments away out of the surface. It's not as if it's a perfect thing. You don't actually remove everything. It depends on how deep these pigments are. With plasma, it's so good because you get the dermal layer removed. Then you go again and you inject heat, which breaks down the pigments. And also you get that fibroblast regeneration at the same time when the part is healing. And then if immediately you apply salt onto the area, then you get that broken pigments to get drawn out of the skin much more easily. It's still an open wound that you're causing, so you can do it. If you do it with lasers, the osmosis, it doesn't work because you're not actually opening the skin as much. You're burning it from the inside, so to speak. I'll show you how lasers operate, and then we'll make some comparisons about lasers and plasma tattoo removal. Meanwhile, if you have any questions, please. So we're going to go into the next one. Again, pardon me, I haven't actually seen this presentation. I'm just improvising. This has been taken from one of the pages of our website, what do you call it, voltaicplasma.com. This is only talking about laser and show you how they actually work. Don't worry about this. Don't need to take too much notes. Everything is on our website, and then these are going to be available on our websites anyway. And this is the normal thing that you see. You get acute tattoo removal lasers. You can call them picosecond lasers. You can call them whatever you like. They are, technically speaking, something called Q-switched lasers. That's all they are. And you can have erbium, YAG lasers, all sorts of different types. I can't even remember them all. So I think some of the pictures will show the types of lasers. But basically, the main difference in the type of laser you're using, either erbium or whatever YAG laser, is the wavelength that you're getting out of these lasers. Because the main difference between the light that we've got outside, the IPL, and lasers is that lasers have got this ability of emitting one or multiple wavelengths. Namely, normally they've got only one. And the more expensive ones, the ones that they market as a multicolor or all color, all in one to two treatments normally have 2 to 3 wavelengths in one shot. That's all they do. But normally what you get a shot that sounds like an elastic band, and then you get immediately the frosting, and the area becomes red, and then it blisters. Various lasers have got various frequencies. Don't get confused by the fact that they call them erbium or whatever they call them, YAG lasers. All you're changing is the wavelength. And also with these devices, you can change the intensity and many other things. This is a picture to illustrate the difference between IPLs here and lasers. Again, for example, I've got alexandrite. You cannot see the number really well here. It's 755 nanometers, and here is 532, if I remember well. I can read it. What happens with IPLs? You've got a broad spectrum of light, which is quite intense. So you're able to remove, to attenuate, to reduce the ability of the follicle to produce your hair, to have lots of hair as I've got here. I'm not going to have mine removed because I'm too sexy with it. Now, so what happens is the longer wavelengths penetrate into the skin much more easily. So, and this is why IPLs are used for hair removal or hair reduction, whatever you want to call it. But also IPLs have got a skin rejuvenation effect. In fact, you get IPLs which have got a lens, and they work at this frequency, at the green, which is this sort of the 532 or thereabouts, and you get these IPLs that are marketed for skin rejuvenation. Basically what they do, only use this sort of color. They use a number of wavelengths, but only those wavelengths that are affecting the skin superficially. And the ones that are used for hair removal have got longer frequencies, and therefore can penetrate deep enough in order to cause you that hair to stop growing. And as they cause that to stop growing, because they've got a heating effect, they break the pigments. And what you have on the market, you have different types of lasers for different tattoo colors, but also you have lasers that are for, what do you call it, hair removal. And all they do, they use a frequency that penetrates deep enough and deep enough to target the follicles. Hopefully that's quite clear. These are the sort of things that are advertised online before and after. Please bear in mind that we don't know whether it's just true or not. Try yourself and you'll see. If you actually find someone who's had a tattoo removed seamlessly with a laser or other means, but just let us know.
We do have Q-switch ruby laser. We do have seamless removals, our own personal photographs. Not Photoshop, no. Okay, so yeah, it can be done, and we have got photographs. Okay, so
good.
And with 12333. All right, so we do have all those photos, and it's not like you say we can we believe this, or we don't know, or we can send you the ones that we send you.
Yes.
Because we will not Photoshop a photograph ever that we advertise. We want you to know it can happen or it can't happen.
And again, this is another picture to show you how laser affect the skin. And not only laser, but the different wavelength of color of lasers affect the skin. The shorter wavelength, which is blue or green, affect the dermis, the upper part of the epidermis, or the upper part of the dermis. And then as you get to yellow or red, you go deeper and deeper. And this is by chance. Look at this wavelength. This is 64 nanometers, which is normally the wavelength used by laser tattoo removal devices. And also 755 is used as well, and so on. So this is the good thing about laser. Basically, what you're doing with plasma, what you're doing is you're burning the surface of the skin, and then the heat propagates. In this case, with lasers, you actually target the part of the skin that you want to target by changing the wavelength, and you can actually get the heat goes exactly where you want it inside the skin, at the depth that you want by changing the wavelength. And this is the case of tattoo removal. You go with the light that penetrates into the skin, it breaks the color pigments, and then the body reabsorbs them little by little. What we're doing is we're actually accelerating that natural process of tattoo reabsorption, because the body rejects it. Although the pigments are very strong and they're meant to last, it's an external body, so as soon as the body has the chance to attack it effectively, it'll try to attack it and reabsorb it and get rid of it as much as possible. And this is what laser tattoo removal does. Breaks the color pigments, and then they're then reabsorbed by the body. This is a representation of a Q-switch laser in here. This is the elastic band effect. This is because for a very short period of time, now the picosecond they're saying, you have a high spike of energy, and that is what causes that sound effect that you've got. This is a colored tattoo, and this is just to show you how color sensitive lasers are. Lasers have difficulties removing the yellows and bright colors, and this is exactly what happened after that session. The darker colors are faded more than the brighter ones, and there's a problem with laser tattoo removal. Normally, the nightmare is with colorful tattoos, which is not a problem with plasma, because plasma is completely colorblind. And it's obviously quite painful, and you have to use numbing products if you can. This is not uncommon. You can get bleeding throughout the treatment. So when you're doing a plasma treatment using plasma tattoo removal, if you see some blood, it's not the end of the world. Remember that also tattoo removal lasers can cause it, and it is a normal thing. Just don't go too deep with plasma, and you'll be fine. And this is a very important graph. It's called the Kirby-Desai graph, a table. And this is just to give you an idea of how difficult the tattoo removal is. And that gives you, say for example, in skin type, first of all, the way it works is, say for example, skin type 6 is the most difficult, so you get the highest points. If you get them on your feet, then you get the highest points. If you get a lot of ink, you get the highest points. If you get double layer tattoos, which is what I talked about, covering up tattoos, you get the highest points. And the higher the point, see if you get color tattoos, you get higher points. You cannot actually see it really well because of the definition of the screen, but you get a number in there. And then you add up everything. The higher the points you get, the more difficult the tattoo removal is, or the tattoo fading is. Say for example, if you only have dark color, 1, so you get quite low points. If there's no scar tissue, the area wasn't treated before, you get a very low point. If you got 1 layer only, you get low point. If you get a low amount of ink, which is the case of permanent makeup, you get very low points. In fact, permanent makeup is quite easy to remove. If you get it on the face, because the face is rich in blood vessels, you get even a low point. And if you've got skin type 1 or 2, very low points. So in theory, a very dark tattoo that is on your face, if you're skin type 1 or 2, should actually be removed really easily, which is the case of permanent makeup. This is why permanent makeup removal is quite easy. But then plasma is a game changer for a number of reasons. Mainly because you remove the first line there, you don't care about what skin type you're treating. It's fine. Even 6 is fine. It's not a problem. You're not having the problem of hypopigmentation that you've got with lasers. And also, it's colorblind. You're not using light to remove the tattoo or fade it. So that is out of the way. And this is why plasma tattoo removal is much is easier. Thank you. Thank you. Oh yeah. Oh, very nice. Yes, it's much more effective because you get rid of this, and you get rid of that. So you don't worry about these two. You still worry about these other guys here. You still worry a bit, but not as much. And again, this is as a reference only. You cannot. It's very difficult to tell how much ink you've got and the type of ink that you've got. So the only way you can tell how many sessions in reality you're going to require in order to get good results is by doing a patch test. If you've got a large tattoo to be removed or that you really want to treat, or the client is adamant that you treat, you do a patch test first, and then by judging the amount of fading that you get, you can make a guesstimation how much you get. And again, this is what you can get with lasers, hypopigmentation, which is something that can happen. Okay, so any questions now? We had so many questions.
Move on.
Okay, fair enough.